Welcome to the deep dive. You know, there's this line I always think about from the Tao Te Ching, something like, we join spokes together in a wheel, but it is the center hole that makes the wagon move. It kind of hints at these hidden connections, right? How the invisible stuff often matters most. And that really connects to what we're exploring today. We're taking a deep dive into reflexotherapy of the feet, or RTF, and we're using Hanne Marquardt's big textbook, Reflexotherapy of the Feet, second edition, as our guide.
Exactly. And RTF, at its heart, it's this manual therapy. It uses the feet, specific zones on the feet to connect with the whole person. It's really seen as a way to supplement modern medicine, boosting the body's own healing ability. And Marquardt's work, it's huge globally. The book's in, 14 languages, 7th edition in German, plus Japanese, Korean, Italian, Spanish, lots more. It shows how much this has resonated worldwide.
Absolutely. So our mission here is to really unpack the key ideas, the surprising bits, and how RTF is actually used, all based on this text. We want to help you understand this perspective on the body and healing, sort of give you the essence without you having to read the whole textbook. Okay, let's jump right in. These reflex zones on the feet, what are they exactly? The book says it's not a nerve reflex, like, a knee jerk.
Right. That's a key distinction. The term reflex here is used more like in reflex camera.
Ah, reflecting something bigger onto a smaller area.
Precisely. Reflecting the whole body onto the feet. And the foundation for this mapping, it partly comes from W. Fitzgerald's idea of these 10 imaginary lines, longitudinal zones, running down the body to the feet. Plus, there's this visual thing, the shape of a seated person, looking remarkably like a foot. It's even the RTF logo. But fundamentally, RTF is about supporting self-healing.
Huh.
On physical and maybe less tangible levels, too. It reminds me of Paracelsus saying touch is the most important remedy.
So it's not just mechanical, there's a deeper philosophy.
Definitely. And while it uses analogies like the foot reflecting the body, the book mentions it's also backed by experimental studies. It encourages a way of thinking that isn't just straight cause and effect. Think about auriculotherapy, No G's work, mapping the body onto the ear because it looks like an embryo. It's about seeing these patterns.
Okay, so moving from the what's to the how, the book really stresses the hands-on manual approach. In our high-tech world, why is that so central here, and what are the basic techniques?
That's a great point. It goes back to that philosophy. Saint-Exupéry's quote is relevant here. It is only with the heart that one can see rightly. The basic therapeutic grip isn't about force, it's rhythmic. An up and down movement using strength and momentum dynamically. This lets the therapist work longer without strain. It's not just pressing hard. Each grip has an active phase and a passive phase, roughly equal in time. It creates this kind of flow.
And are there specific ways to use the hands or thumbs? How do you get that focused stimulus?
Yes, the basic thumb grip is key. Picture the arms swinging, like a pendulum. The thumb pad touches first gently, then the end part of the thumb, the distal phalanx, sort of passively unrolls and bends. Then the thumb tip actively takes over, bending to about 90 degrees, pushing the stimulus deep into the tissue. It's very controlled.
Precise.
Exactly. But sometimes you need gentleness. There's the sedating grip. That's mainly for pain, maybe in a specific spot or treating a scar. Or if a zone just suddenly feels really sensitive during treatment, it could be as simple as just calmly holding that irritated area, letting it settle.
Okay, and how do you know how much pressure or how long to treat? The dosage?
Dosage is critical. And it's very, very individual. You have to watch the patient's reactions closely. You look for signs of normalization, less pain, better blood flow, the tissue feeling more normal, fewer autonomic signs like sweating or breathing changes. Is it a constant feedback loop?
What if someone reacts strongly, maybe finds it too intense, an overreaction?
Good question. The advice is clear. Ease up. Reduce the intensity or speed of the grip. Or use that stabilizing grip, just gently holding the spot. The book makes a great point. Patients are usually the best indicator because they spontaneously sense what is good for them. You have to listen to their body.
Makes sense. Now, you mentioned versatility earlier.
Mm-hmm.
Where else is RTF used besides, say, a dedicated practice?
Right. It's not just for feet in isolation. It gets integrated into physical therapy, clinics, rehab centers, doctors' offices, and importantly, it can be used alongside medication. It's meant to work with other treatments, not necessarily replace them.
And building on that, the book talks about reflexotherapy of the hand. When does that come in? Is the mapping similar?
Yeah, the hand therapy is a really practical alternative or addition. Think about patients with amputated legs or foot injuries, maybe someone in a cast.
Right, when you can't access the feet easily.
Exactly. And the mapping idea is consistent. Fingers relate to the head and neck. The palm further down, the distal part, connects to the chest and upper abdomen. And the base of the palm near the wrist corresponds to the abdomen and pelvis. It's also great because patients can often do some self-treatment on their hands as homework.
Oh, interesting. Empowering them a bit.
hmm And then there's this other concept, collateral and contralateral treatments. What's that about? It sounds complex, but the idea is simple. You can treat the opposite limb, quadrilateral, or the corresponding limb on the same side, collateral. So say someone strains their left calf. You can work on the same spot on the right calf, that's contralateral, or you can work on the related area on their left forearm, that's collateral. It's really useful for people in casts, helps prevent muscle wasting, and might even support fracture healing.
Wow, that opens up a lot of possibilities. So thinking about these different approaches, how does RTF adapt for specific groups of people, like maybe pregnancy?
Yes, the book covers several special groups. For pregnancy and birth, RTF can be used starting around the 4th month, maybe once or twice a week. It can help with common things like pelvic pain, and even during labor, for issues like uterine inertia, slow labor, or contractions that are too intense, specific grips can be used, tonifying or sedating, depending on what's needed.
Gentle support. What about right after birth for newborns?
For newborns, it's all about gentle stimulation, supporting their self-regulation, maybe helping organs that seem a bit weak, like for neonatal jaundice, gently working the liver and gallbladder zones might help excretion. Or for breathing issues, treating the related upper airway zones on the tiny feet. Babies tend to respond very quickly.
And for people who are chronically ill or bedridden, it sounds like touch itself becomes really important there.
Absolutely. For these patients, it's about lots of stabilizing grips, very cautious and gentle work, focusing on key systems, heart, spine, lymph, digestion, endocrine system. The book specifically mentions autoimmune conditions like AIDS, especially if the white blood cell count is low. It suggests neutral stroking, stabilizing grips, emphasizing that mindful touch itself is really vital for well-being, even if the disease process isn't reversed.
That's very compassionate. And in palliative care,
Yes, even more so there. In palliative medicine, even if you don't expect the condition to improve, the act of cucking the feet is described as profoundly supportive. Comforting. There's a specific technique mentioned, tracing a lemniscate, that infinity symbol on the soles, which is found to be very calming during the transition between life and death. And for managing severe pain, you'd use sedating grips on the zones related to the pain source, like the stomach zone for stomach cancer, or head zones for brain tumors. It's about providing solace.
that's really quite profound. So after a treatment session, what kinds of reactions might someone experience? What does the book say happens next?
That's a key part of the process. Reactions often show up in the body's excretory systems, digestion, urinary tract, even the skin or mucous membranes. Changes in mood, sleep patterns, those are common too. It shows how RTF affects the whole person. These reactions are seen as positive signs, part of the self-healing kicking in. They could happen during the session, between sessions, or even after a whole series of treatments.
And it's not just physical.
No, not at all. On an emotional level, people might laugh, cry. Sometimes old traumas might surface unexpectedly. Mentally, someone might suddenly realize, wow, my diet really isn't helping me, or I need more exercise.
Yeah.
And sometimes, on a spiritual level, people report gaining a new perspective on their illness or their life situation.
I've heard about something called Herring's Law in relation to healing reactions. How does that fit in?
Yes, Herring's Law is relevant. The idea is that as a major symptom, like intense pain, starts to get better, other less severe issues that were kind of masked might become noticeable. So someone might feel, paradoxically, worse than before in some ways. The example given is like a severe headache lessens and suddenly you notice this nagging stomach ache you weren't paying attention to. The body is sort of working through things in layers.
Okay, I see. Let's dive into some of those really specific, maybe surprising connections the book highlights, like foot sweat.
Right. It sounds mundane, but it can be informative.
Yeah.
If someone used, say, strong antiperspirants and suppressed foot sweating, during RTF treatment, that sweating might return. And apparently, it often has a sour smell initially. This is seen as a sign that chronic issues may be related to kidney or liver function or rheumatic problems are starting to improve. The body's clearing things out.
Wow. Okay, so it's not just what comes out of the feet. What about things on the feet, like corns?
Yes, even corns. They're not just seen as friction spots. The book gives examples like a corn near the base of the little toe, potentially relating to shoulder issues.
No way.
Yeah. Or one between the second and third toes, possibly linking to eye problems. It really emphasizes this idea of the foot as a detailed map.
And this mapping links to emotions, too.
Definitely. Painful zones in the digestive tract area might show up when someone's struggling to emotionally digest a difficult situation.
Well,
Or tender pancreas zones could relate to feeling a lack of sweetness or joy in life. Problems in the inner ear zones, linked to balance, might reflect a feeling of being off balance in life generally.
the body's speaking its mind, so to speak.
In a way, yes. The book even brings up teeth as potential interference field.
Teeth, how do they connect?
Well, things like root canals, devitalized teeth, or even scars in the mouth area can apparently affect distant parts of the body. There's an anecdote about a dancer with bad lower back pain. Her wisdom teeth looked fine on x-rays, but the corresponding zones on her feet were painful, and addressing the teeth resolved the back pain. It suggests looking at tooth zones, maybe using a dental chart like the Vole chart, alongside related organ issues, like hip problems might connect to specific canine tooth zones, 13, 23, 33, 43 in that system.
That's fascinating. Okay, tell me about this anecdote involving meridians and shoulder pain. That sounded really striking.
It is a great example. A patient had severe left shoulder pain, but the shoulder reflex zones on her feet weren't particularly sensitive. Instead, the zones for her descending colon and sigmoid colon were intensely painful.
The gut zones, not the shoulder zones.
Exactly. So the therapist treated the colon zones. Afterwards, the patient had a significant bowel movement, and her shoulder pain just vanished spontaneously. The explanation ties into traditional Chinese medicine concepts. The large intestine meridian energetically influences the shoulder area. It shows these less obvious connections.
Mind-body connection in action.
Absolutely. And one more key structure, the diaphragm. It's physically between the chest and abdomen, affecting both. The book stresses its importance, especially for cardiac patients. If the diaphragm is tight or restricted, maybe due to gut issues, it can hinder fluid movement and deep rhythmic breathing. RTF aims to help free that up.
Okay, this is all incredibly detailed. Let's bring it home with some practical examples, some case studies showing how this works in practice.
Sure. The book mentions a 1993 Swiss study on postoperative urinary retention difficulty urinating after surgery. Out of 56 patients, 41 regained normal function without needing medication, typically after just 2 or 3 short RTF sessions focusing on the bladder, pelvic floor, and sacrum zones. Pretty effective for an acute issue.
That's impressive. And what about that case of chronic constipation? That sounded dramatic.
It really did. A 24-year-old woman, constipated basically her whole life, maybe one bowel movement a week.
Wow.
After just one cautious RTF session, she started having daily movements. Then, a more vigorous session later actually triggered a gallstone attack. She passed a stone. Turned out she had gallstones she didn't even know about. The RTF seemed to stir things up.
Uncovering hidden issues. What about kids, say with hyperactivity or ADHD?
For kids with ADHD, the book points to the lymphatic zones, spleen, appendix, tonsils as often being key areas to work on. And interestingly, for some of these kids, gentle touch on the feet might be the only physical contact they tolerate initially. So RTF can be a gateway. Simple things like mobilizing the toe joints, gently stretching the spaces between the toes can be really beneficial.
And allergies. You mentioned the book asks, to whom or what are you allergic? What's the implication there?
It hints at the psychological dimension often present in allergies. Common phrases like, I can't breathe for asthma, or someone with skin issues feeling like they don't have a thick enough skin. RTF treatment for allergies often focuses on the digestive system, the autonomic nervous system, and the lymphatic system, addressing it holistically.
Right, the broader picture. And finally, self-treatment. People
Right.
can do this themselves.
Yes, that's encouraged. There's a case of a 44-year-old woman with some abnormal cervical cells. She did self-treatment on zones for the pituitary, adrenals, thyroid, spleen, and uterus for just 5-10 minutes every couple of days. After 6 weeks, her follow-up smear test was negative. Of course, that's anecdotal but suggestive. Another quick one. A woman had severe pain in her ovary zone on her foot for 2 days. Then she had a ruptured ovarian cyst requiring surgery. After the surgery, the foot pain was gone. A direct link, almost predictive.
Incredible connections. So, wrapping this up, it's clear RTF presents this really deep view of the body's interconnectedness. From small things like corns pointing to shoulder issues, to gut problems reflecting emotional states, or even how a scar might affect something totally unexpected like the pancreas.
Exactly. And the real power, as the book presents it, is RTF's ability to kind of wake up, support, and balance the body's own healing abilities. It's a strong reminder that our physical health is tied so closely to our emotional and mental states, and that intentional touch can be incredibly powerful medicine.
Yeah. This deep dive really hammers home that our feet aren't just things we walk on. They're like this intricate map reflecting our whole state of being. So here's a final thought for you to take away. If our feet really do mirror our whole selves, what subtle messages might your own feet be sending you right now about your health, your balance, your well-being? What could you learn just by paying a little closer attention?